I'm Jo Levy. I'm Deputy Head of the Counselling Service. We've been delivering mental health training and the mental health first aid training to King's staff over the last 2 years. We've taught actually over 350 members of staff, and it's a course to highlight signs and symptoms of different mental health disorders, but to actually talk about mental health, to reduce stigma and discrimination, to equip them with the tools to support students, to prevent students from reaching crisis point. Okay, so I'd like this group to think about, to begin with, acceptable, non-judgmental and neutral words and phrases around mental ill health. Yeah? And this group, if you start on the negative, unacceptable and critical words or phrases, and try not to filter too much, be quite free and creative around that. And then you'll get a chance to swap around, yeah? So you may use words or phrases that you really feel are unacceptable. Go for it. Think about, if you were talking about your own mental health or somebody else's, what words would you use? There are a lot more students at risk at the moment. 75% of mental health illnesses actually start before the age of 18. So we have a lot of students coming in now with pre-existing mental health conditions, needing support. Yeah. And if we can provide the right support, early intervention, there's really good outcome, and the students can actually engage in studies here, whether they have a diagnosis of depression or not. So if you hold up your... So look at the difference. I was kind of joking, but it's always the way that the negative and critical always tends to be sort of very quickly and scribbled, but not quickly, but it always looks like this, whereas the positive acceptable always tends to be a very neat list. And look at the different words we have and descriptors. It's still so hard to come up with positive, acceptable, non-judgmental words and phrases around mental ill health, that using the wrong type of language or negative language can have a real impact.
I'm Stephanie Griffiths, known as Stevie, and I'm Head of Counselling at King's College London. Whenever a student arrives at university, they come with their baggage, in as much as they come with pre-existing problems, they come with issues that might have affected them as a child. So what we're trying to do at King's is help students feel that whatever they come with, they're going to be accepted, their issues will be looked at in whatever way is appropriate, either therapeutically or just by being able to talk to fellow students, tutors, administrators, anyone who is there on the receiving end. Right, could you please turn to page 10 in your workbooks, and you'll see two rather nice t-shirts. So on the front of the t-shirt, design something that shows what people see. On the back, write what the depressed person is experiencing inside. Yes. Yeah. So it's about... So how are you getting on? We all got t-shirts to show.
The front is kind of a blank expression.
Yes.
And the hair is supposed to be unkempt.
Yes.
They're not looking after themselves. So that's what we see.
That's what we see.
Yeah.
Perfect.
And then that's not a hat, it's a weight. And a cloud.
Yeah. The thing is with students is they're often very scared because they're, by nature of their age, certainly the undergraduate population, quite impetuous. So they're conscious that they might just do something, and then when they're kind of feeling a little better, remember they're sort of dipping in and out of it, they're thinking, oh, I could so easily have done something. Do others agree with that?
There's some decisions that I've made that have been, I think, intentionally against the way that I was raised, which is affecting me. But,
Yes.
So I agree.
I hope that they'll enjoy the 2 days. Some of it's quite hard. I hope that they'll learn some tools to actually equip them to look after themselves and others, and how to actually support the students as well as support each other.
So it's just having that capacity to hear from their perspective. So do, as I say, look after yourselves and enjoy day 2 of the course on Tuesday. Bye.